Precision Oncology. How a common painkiller could reduce colorectal cancer recurrence. New clinical trial results suggest that a low-dose, widely available medication aspirin could play a significant role in preventing colorectal cancer from returning after surgery. However, the benefit is not universal. The drug appears to be most effective for patients with specific genetic profiles. The genetic connection. The PI3K pathway. The study, led by researchers at Karolinska Institutet and Karolinska University Hospital, focused on a specific biological driver of cancer, the PI3K signaling pathway. This pathway is responsible for controlling cell growth and survival. When mutations occur within this pathway, it can cause cells to grow uncontrollably, leading to tumor development. The research highlighted that approximately 37% of patients in the trial possessed these specific genetic alterations, making them prime candidates for targeted therapy. Key findings from the ALA-SCCA trial. The ALA-SCCA trial was a large-scale, randomized study involving over 3,500 patients across 33 hospitals in Sweden, Norway, Denmark, and Finland. Participants were assigned to take either 160 mg of aspirin daily or a placebo for 3 years following their surgery. The results demonstrated a significant reduction in cancer recurrence for those with specific mutations. PIK3CA mutations. The recurrence rate was only 7.7% for patients taking aspirin, compared to 14.1% in the placebo group. Related genetic alterations. Patients saw recurrence rates of 7.7% with aspirin versus 16.8% with the placebo. Overall impact. For these specific subgroups, aspirin effectively cut the risk of recurrence by nearly half. In terms of survival, nearly 89% of patients treated with aspirin remained cancer-free after 3 years, compared to a range of 79% to 81% in the placebo group. Why this matters? The shift toward precision medicine. This study is a landmark example of precision medicine, the practice of tailoring medical treatment to the individual characteristics of each patient. Rather than applying a one-size-fits-all approach, doctors can use genetic testing to identify which patients will actually benefit from the medication. Why aspirin might work? Researchers believe the drug's effectiveness stems from a combination of factors: reducing inflammation in the body, limiting platelet activity, which may hinder the ability of cancer cells to spread, interfering directly with tumor growth mechanisms. Risks and considerations. While the benefits are promising, the treatment is not without side effects. The study reported that 16.8% of patients taking aspirin experienced severe side effects, compared to 11.6% in the placebo group. This highlights the necessity of careful patient selection through genetic screening to ensure the benefits outweigh the risks. A highly accessible solution. One of the most impactful aspects of this research is the cost-effectiveness and availability of the treatment. Unlike many modern, high-cost oncology drugs, aspirin is inexpensive and accessible worldwide. If these findings are integrated into standard clinical guidelines, it could provide a highly efficient tool for cancer management globally. This is a clear example of how we can use genetic information to personalize treatment and at the same time save both resources and suffering, says Anna Marteling, lead author and professor at Karolinska Institutet. Conclusion. By utilizing genetic profiling to target specific mutations, aspirin could serve as a highly effective, low-cost tool to significantly reduce colorectal cancer recurrence in high-risk patients.